How does endoscopic brain surgery work as a minimally invasive option? Imagine being able to treat brain issues through tiny openings or natural pathways instead of large skull cuts. That's what endoscopic brain surgery offers. It uses a thin, flexible tube called an endoscope, which has a small camera and light attached. This device allows surgeons to see inside the brain in real time on a monitor. They can then perform precise procedures using special instruments inserted alongside the endoscope. The most common approach is called the endoscopic endonasal approach. Surgeons make one or two small incisions in the skull or go through the nasal passages and sinuses to reach the brain. This means they can access areas at the base of the skull or near critical structures like nerves and blood vessels without cutting through the face or removing large parts of the skull. The camera transmits detailed images, guiding the surgeon to remove tumors, repair blood vessel issues, or treat other brain conditions with high accuracy. Because this method avoids large openings and extensive brain retraction, it reduces trauma to the brain and surrounding tissues. Patients often experience less pain, less blood loss, smaller scars, and a lower chance of infection. Recovery times are generally shorter, and hospital stays tend to be reduced. This makes endoscopic surgery a popular choice for suitable cases, especially when tumors are located in hard-to-reach areas at the skull base. The technique is especially helpful for tumors and lesions near important structures like cranial nerves and major arteries. Using natural pathways like the nasal cavity and sinuses, surgeons can reach these areas more safely and with less disruption. However, like all surgeries, endoscopic brain surgery has risks, including bleeding, infection, swelling, seizures, or accidental damage to blood vessels. The decision to use this minimally invasive approach depends on factors such as tumor size, location, the patient's overall health, and the surgeon's experience. In summary, endoscopic brain surgery works by providing a less invasive route to treat brain abnormalities. It uses a tiny camera and instruments inserted through small openings or natural passages to visualize and operate on the brain with precision. This approach supports brain health by minimizing surgical trauma while effectively addressing tumors and other conditions. Always consult with a qualified healthcare professional to determine the best treatment plan tailored to individual needs.